press conference is targeted containment measures and soundly recovery of the medical service order. We have with us DG Mao Qing'an, Inspector Madam Wang Bing, Madam Guo Yanhong from the Healthcare Administration Bureau, Dr. Wang Guiqiang from Peking University No. 1 Hospital, Professor Feng Luzhao, researcher with China CDC, and they will give us answers to questions related with the topic. We have also with us today Professor Wang Chengguang from the School of Law of Tsinghua University to give us the common knowledge about health, about law. Now let me give you the updates. Yesterday, China's mainland reported new confirmed cases 39, new fatal cases 3, including 2 in Hubei and 1 in Liaoning, new suspected cases 31. Yesterday's newly cured and discharged cases 730, close contacts removed from medical observation 1,197, and the number of severe cases dropped by 178. By the end of yesterday, China's mainland reported that the remaining confirmed cases numbered 6,569, including 2,136 severe cases. In accumulative terms, there have been 71,150 cases cured and discharged from hospitals, 3,248 fatal cases, and 80,967 confirmed cases. The remaining suspected cases numbered 104. In accumulative terms, close contacts traced numbered 684,331, and close contacts still under medical observation 8,989. For Hubei province, yesterday there is no new confirmed case, no suspect case, no remaining suspected cases. For cured and discharged cases, the newly increased numbered 703, including 624 in Wuhan. The new fatal cases, 2, both of them in Wuhan. The remaining confirmed cases numbered 6,287, including 6,118 in Wuhan. Among these cases, there are 2,098 cases of severe symptoms, including 2,062 cases in Wuhan. In accumulative terms, there have been 58,381 cases cured and discharged, including 41,389 in Wuhan. For fatal cases in accumulative terms, 3,132, including 2,498 in Wuhan. For confirmed cases, the number in total reached 67,800, including 50,005 in Wuhan. Yesterday, between 0 and 24 o'clock, the newly reported cases from overseas reached 39, including 14 in Guangdong, 8 in Shanghai, 6 in Beijing, 3 in Fujian, and 1 in Tianjin, Liaoning, Heilongjiang, Zhejiang, Shandong, Guangxi, Sichuan, and Gansu, respectively. By the end of yesterday, altogether, there have been confirmed and reported imported cases numbered 228. Altogether, there have been 333 confirmed cases reported from Hong Kong, Macau, and Taiwan, including 208 from Hong Kong SAR, 17 from Macau SAR, and 108 from the Taiwan region. Outside Hubei, all the provinces in China have 39 confirmed cases, 31 suspected cases. All of them are imported ones. For new fatal case 1, and the severe case number dropped by 2. Yesterday, on March the 19th, for the first time, domestically and for the confirmed and suspected cases, there is no case. 18 provinces have found 0 case increase in terms of the confirmed and the suspected cases. Among the confirmed cases, the severe cases represent 37.5%. So it is necessary to treat the severe cases. According to WHO's briefing, in the American continent, the number of confirmed cases reached over 9,000. For the European region, for 2 days in a row, the number of confirmed cases have been more than 10,000 cases. So it is necessary to consolidate the achievements we have made domestically and prevent the importation risk. Now the floor is open for Q&A, and please identify yourself. The first question on the left, on the front row, the first gentleman, please. With Xinhua News Agency, a few days ago, the Central Committee of the CPC requested that in low-risk regions there should be full recovery of the business and operation. So my question is about the health QR code. Can it be recognized, and what is the schedule for the mutual recognition of the health QR code? We will have DG Mao to answer the question. Okay. Following the guidance, in the light of the specific situation in the localities, we have requested the localities to provide targeted services. The health QR code is used to monitor the flow of people and ensure the orderly recovery of business and operation. For the mutual recognition of the health QR code, in the government website, you may find dedicated columns containing the relevant information about the health QR code and also the relevant databases. Now the basic databases are mutually recognizable. By the end of yesterday, 1.29 billion times of information sharing have been achieved. The relevant government authorities like NHC have also provided 3 channels for mutual recognition of the health QR code, and the localities can choose one of them in the light of the local conditions. The first channel is to achieve data sharing in the locality, and based on that, adding the mutual recognition function in the health QR code. And the second channel is to harmonize the health QR code with the information code on the national database. By doing so, we can also achieve the mutual recognition. And the third approach or third option is that for localities who have not adopted the health QR code, they can just use the nationwide information database and in the light of their local conditions, recognize the health QR code from other localities. Up to now, technical harmonization has already been achieved. Thirdly, we are promoting the one code for all approach. The mutual recognition is difficult to achieve because the local governments have differentiated policies.
98% of the counties are now belonging to the low-risk counties. Provinces and counties are accelerating the convergence of a health information catalog. With the national information, localities have been using the national platform and deepening efforts in the mutual recognition and compatibility of the health barcodes in communities, workplaces, public places, and other service providers. This information can be shared. Up till now, one health barcode can be used in almost all the places above mentioned. Thank you. Next question, please. Journalist from the second row on the right side with China Media Group CCTV. Internet plus treatment has become popular during the epidemic prevention and control. What has been the role of the online diagnosis and treatment? Will there be future favorable policies to support the online diagnosis and treatment? I'd like to ask DG Mao Chuan to take the question. Internet is convenient in providing services. In the epidemic prevention, the unique merit of Internet plus medicine has been leveraged by setting up a platform of service provided to the general public, online consultancy, online counseling, online chronic disease treatment, and online drug distribution have been provided. Health services provided online can also be reimbursed by the medical insurance, thus alleviating the offline treatment pressure. In the period of epidemic prevention control, online services have become an integral part. According to statistics, during this period, the online treatment has increased by 17-fold compared with the same period of last year. Some well-known third-party online diagnosis has seen an increase of 20-fold. Prescriptions increased by 10 times compared with the same period of last year. We've also organized a platform of Internet plus health service support to Hubei province. We expanded the service provided, improved the quality of the service to support the efforts in the front line in Hubei. Online treatment center has established an online consultancy service. We've organized the health providers and experts team to provide intelligent telemedicine. We've also leveraged China Traditional Chinese Medicine Administration and other institutions to provide online TCM treatment and services. We've asked help from the Peking Psychological Research Institute and the Peking University affiliated hospital to provide psychological support online. We've also used the China Academy of Science efforts in establishing the database for sharing digital resources. Second, we've collected data from diversified institutions. Big data plus grid management have been used to track and trace the close contacts and risky groups. Recently, there have been media reports about the general public's opinions on summarizing the success from the Internet plus services and can institutionalize such practice. We will collaborate with other departments to discuss the benefits so as to deepen and prolongate and institutionalize Internet plus services. Next question, please, journalist from the first row on the right side, please. With Phoenix TV. The pandemic is spreading rapidly in 160 plus countries. The confirmed cases outside of China have exceeded 130,000 plus. Many overseas Chinese are very much concerned. What are the health tips for them in their daily prevention control? I'd like to ask a researcher from Lu Zhao from CDC to take the question. Thank you for your question. Overseas Chinese nationals studying or working abroad can use the following measures to minimize the infection risk and protect their own health. First, personal protection should be emphasized. Domestic prevention control experiences have shown us personal protection carries great significance. I have a short poem for you frequent hand washing, more frequent ventilation, avoid crowds, wear masks, and cover your mouth and nose. Basically, we are still using these traditional methods. Wash your hands more frequently, enhance the sanitation and ventilation, 2 to 3 times ventilation of your indoor environment, avoid crowds, reduce the social gatherings, and when you have to talk with others, keep the distance of 1 meter and above. Avoid going to a crowded place. Wear masks when you are in public places, when you are in public vehicle, or when you are in a public place. And cover your mouth and nose when you cough and sneeze. Use the tissue or your elbow to cover your mouth and nose. Besides, we also recommend the minimization of unnecessary travels. The long-term staying in semi-confined public transportation vehicles may enhance the risk of contagion. So minimize unnecessary travels to reduce the risks. As long as we do a good self-protection, avoid crowded places, even in hard hit regions, you can still reduce the risk of infection. Besides, we remind Chinese nationals to pay more attention to science tips, learn the epidemic changes and trajectory in the locality. If there is a fever or other respiratory disease symptoms, they are recommended to use online services for counseling. When necessary, seek medical rescue. But if you go to a hospital, please make sure that you wear your personal protection equipment, and in emergency you can ask the Chinese embassies and consulates for help. Thank you, Researcher Feng Luzhao. As Researcher Feng Luzhao has mentioned, Chinese nationals overseas are recommended to to learn more information. I have a QR code on the NHC website. On the first web page, we've opened a thematic column in which you can find health tips and science knowledge. We also have email to receive the questions from netizens to facilitate Chinese nationals home and abroad to search the information. I have summarized the information and put up the QR code here. You can check the QR code, and you can also visit our website. We also have set up an email box to receive the questions from Chinese nationals, in particular from abroad. If you have health-related questions, you can use that email box. We will try to respond as quickly as possible. As DG Mo Quan has mentioned, domestic health institutions have carried out online services. So Chinese nationals are also recommended to ask for health counseling through the online services provided by health providers. Thank you. Next question, please. Journalist from the second row on the left side, please. Thank you. With Beijing Broadcasting Radio, when there is a tension in international epidemic prevention and control, China has promoted the zone, risk zoned, precise management of the epidemic. Will we adjust our precise prevention and control strategy in the context of ever-changing international landscape in Beijing, Shanghai, where there's a big inflow of overseas Chinese and returnees? Will there be any changes? I'd like to ask Inspector Wang Bin to take the question. Currently, the pandemic is growing rapidly in the world. We are under greater pressure for imported case prevention.
At the moment, the overall containment measure that we have adopted are to control or prevent the domestic spread and the overseas importation. Specifically, we will continue to bring into play the joint control mechanism, which has already been established in the previous epidemic control. And the accountability system will be enhanced further. We emphasize early detection, early reporting, early treatment, and early prevention. So we will have such well-targeted measures to ensure the risk of importation be minimized. And second, we will provide targeted measures against the potential importation. For patients with fever or with suspicious symptoms, they will be timely transferred to the designated healthcare facilities for further screening or confirmation. And second, for the close contacts, they will be transferred to the concentrated designated quarantine sites for 14 days. And during the quarantine period, if they develop any suspicious symptoms, they will be transferred to the designated healthcare facilities. And thirdly, for people who were identified when they were still overseas to have suspicious symptoms or any potential risk of being affected, they will be followed up closely and also will be quarantined accordingly. Furthermore, for other people, we will strictly follow the local rules and regulations to ensure the potential spread of the epidemic will be minimized. Secondly, we focus on the potential importation of the risk. So for inbound travelers, there will be well-targeted and well-conducted measures such as the grid management and health monitoring will be continued and sustained. Let's continue. On the right, on the third row, the lady reporter, please. Thank you. With the cover news, we noticed that medical teams are returning back to their hometowns. May I know the number of medical teams who are still stationed in Hubei, and also for the returned medical teams, what kind of quarantine that they should receive, and how long will they be back to their normal posts? We will have Madam Guo to answer the question. Thank you for your question. At the moment, the situation in Hubei province is improving. In particular, the treatment of the patients is improving, and the daily order is being recovered. So according to the arrangements of the State Council and the CPC Central Committee, the medical teams will be orderly returned to their hometowns, and such return is conducted on the basis of the sound order in the Hubei province, and the medical teams have started such a returning on March the 17th, and 12,000 medical professionals have returned to their hometowns. They are mainly the medics who are working in the the makeshift hospitals. We will continue to arrange the national expert teams and the leading expert teams remain in Hubei, in particular the designated hospitals for severe cases, and they will not be back until the severe cases are treated. The localities have attached great importance to welcome back the medics, and there have already been sound planning after they arrive at their hometown. So the quarantine, the daily lives, and the breaks or the the days for rest are well arranged before they come back to their posts. So Madam Guo has talked about the return of the medical teams. I think it is fair to say that from the Lunar New Year Eve to the spring equinox, the medical teams have worked day and night to contain the epidemic, and now they are returning to their hometowns. I would say that welcome back, and you are truly the heroes of us. And I have written a short poem to extend my gratitude and respect for them. So let's continue our Q&A with Hong Kong China Review. According to some media reports, the hospice care is provided due to the lack of specific and well-targeted drugs or medicines. So what about the future treatment of such severe cases? We will have Professor Wang to answer the question. Thank you for your question. Indeed, COVID-19 is an acute respiratory disease, and at the moment we don't have any specific drug, so the symptom treatment is the most important approach. The severe cases are mainly the elderly patients with underlying conditions. So based on our previous experience, especially the experience accumulated in the front line in Wuhan, Hubei province, we have updated the treatment protocol for population with underlying conditions. We adopt the multidisciplinary cooperation approach. So in the front line, you will find an expert team with all the relevant disciplines working in the same team. So this is truly a new disease, even though the disease mainly damages the respiratory system, the pulmonary part, or the lungs. Still, other human systems are also endangered, so we need such a multidisciplinary team. We also offer specific guidelines to cure or to rescue the critically ill cases. So apart from the oxygen therapy, we also have other therapies like the convalescence plasma and etc. We are using these approaches to improve the result, the outcome of treatment. For severe cases, in the treatment, we also engage the nurses. As you know, nursing care is critically important, especially for the severe cases. Just now, I mentioned the importance of oxygen therapy, and we need to differentiate the symptoms and provide well-targeted and specific therapies. Like in Wuhan, the intubation is conducted by a dedicated intubation team because intubation is very complex and difficult to achieve. So the intubation team is working among the designated hospitals, and they have worked very hard. And of course, as this is a new disease, we are constantly studying and improving our treatment therapies. We hope that with further studies, we can come up with better therapies or approaches.
Our current treatment and measures have reduced the fatality rate and increased the cure rate. It is our hope that with our continuous study, we can have more precise treatment protocols to guide clinical treatment. Thank you. Next question. On the third row on the left side, with CCTV financial channel, according to media reports, many local governments have issued documents encouraging the public to consume so as to help the catering industries to go through the rough patch. But we know if you are to dine, you have to take off your masks, and it may lead to the intensity of people gathering density, then will that lead to a risk of cluster cases? So how can we ensure appropriate consumption while maintain effectiveness in the epidemic prevention and control? Director Wang Bin is to take the question. Thank you for your question. The prevention and control is trending positive. Catering industry has a close bearing on the overall economic and social development. We require local governments to contextualize their lifting of bans gradually, and they should pay attention to the following points. First, the business owners should still be accountable for prevention and control before restarting of their business in their business venues, including the halls, the kitchens, and also the cooking utensils should be thoroughly disinfected and sanitized. And at the entrance of the restaurants, there should be dedicated staff taking the temperature check on the customers. There should be a control on the number of inflow customers. Better use the appointment reserve services, reservation services, and ventilation should be more frequent. Disinfection sanitation should be more thorough. The washing basins and facilities as such must be functional, and there should also be the equipment. The restaurant should also be equipped with the hand sanitizers. The staff of the restaurants should wear masks, and their health should also be monitored. The processed food must be separated in the raw material and the cooked materials. Poultry, eggs, and meat products must be thoroughly cooked. Each day, the public places, the toilets, and the frequently touched public items must be disinfected more frequently. When the public and the consumers are taking the food, they should still pay attention to keep social distancing. Use the public chopsticks when you are to share food. Thank you. Next question, please. Journalist from the third row on the right side. Thank you. With CNS, I have a question on virus testing. What are the major types of testing for confirmation of the case? What is the average time for the testing report? Shortly before, there were reports that within 15 minutes, the testing kits can generate the test result. So I'd like to learn more information on this. I'd like to ask a researcher from Luzhou to take the question. Thank you for your question. The approved testing kits include two types, NAT tests and antibody test kits. Up till now, China has approved 12 NAT test kits, 8 antibody test kits, including 5 colloid, 5, and magnetic micros, 3. So IgG and IgM antibody test kits. In the future, we will approve more of the test kits. For the NAT tests, it follows several steps with the average generation results time 2 to 3 hours. NAT tests directly the segments of virus. It is highly specific and sensitive. NAT test remains one of the major testing methods in clinical tests. And for the IgG, IgM tests, the glucoloid testing time is 15 minutes. 1 drop of blood can generate visible testing results. So I guess you are referring to these kind of visible testing results. But if you use the serum, not the whole blood, the serum treatment may take some time. And the second is the chemistry fluorescent magnetic micros testing. It may take 30 minutes. Antibody test tests the antibody level in the blood. In the early stage of infection, it is possible that the patient hasn't generated antibody yet, so there is a waiting window. Antibody can be used for further test to NAT test the negative results. It can also be used for the screening, but it cannot replace NAT tests. Thank you. Next question, please. Journalist from the fourth row on the left side. Thank you. From the CNR. In previous press conferences, there were information from NHC that there was zero infection of the 42,000 medical staff who went to Wuhan to provide help. We know it is a highly infectious disease, but how did we realize zero infection among the assisting health staff? I'd like to ask Madam Guo to take the question. Thank you for your question. Yes, indeed. There have been 42,000 plus medical staff who went to Wuhan to provide help, and now zero infection. We are gratifying to see such a result. We used a combination of measures to realize this zero infection in a win battle. We have adopted 4 measures. First, technical guidance, in particular on the personal protection, the use of personal protection equipment, the procedures of personal protection. These technical standards have been effective in guiding medical staff to improve scientific prevention and protection. Second, we've also issued an array of requirements for nosocomial prevention control. In the IPC prevention, we have set up 3 zones, 2 corridors, standardized prevention and extra prevention. So there were several principles to be implemented to guide health institutions to prevent nosocomial infection. Third, we've sent an experts panel on the prevention of nosocomial infection. This experts panel has guided the Hubei provincial hospitals and Wuhan hospitals to improve their nosocomial prevention control, worked on their procedures and protocols. Besides, this expert panel has also undertaken another important task. Prior to the engagement of the assisting medical staff, the expert panel provided training to the supporting medical teams so that they can better understand the principles and usage of protection. Besides, it is vital to ensure the protection materials with concerted efforts from multiple departments and governments. Within a short span of time, we've allocated sufficient medical supplies to the front line so that there was sufficient provision of protection equipment. It is an emerging disease, previously unknown to all. We have been understanding it gradually, and our understanding is the prerequisite for setting up scientific prevention. Thank you. Next question, please. Journalist from the fourth row on the right side, please. Thank you. With China Daily. Since the outbreak of the epidemic, the Patriotic Health Campaign Committee has issued notices and advocacy. What has been the role of such advocacies? Will there be some next step plans? I'd like to ask DG Mao Quan to take the question. As we all know, Patriotic Health Campaign has been a traditional treasure and a unique merit in combating infectious disease after the outbreak of COVID-19. In the early stage, critical stage, and the resumption of business stage, The Patriotic Health Campaign Committee focused on the weaknesses, market environment, the livelihood of the people, and deployed thematic activities. City sewage, public toilets have been some of the linchpins in our campaign. We promoted the improvement of city and rural sanitation.
For personal health and sound nutrition habits or dietary patterns, there have been specific activities, and also there are ongoing local specific activities. Like in Shanghai, it has been advocated that for the collective dining, there should be public chopsticks or chop spoons. Furthermore, there are also weekend health campaigns in Shandong, while in Hainan, there are major health campaigns to demonstrate your patriotism. By these major health campaigns, public awareness of health is being enhanced. Recently, together with other government agencies, the National Patriotic Health Office has initiated the months for patriotic health campaigns. We're using these initiatives to improve people's health awareness, clean the environment, and also to say no to the unhealthy practices in people's daily lives. Public awareness promotion and advocacy have been conducted to consolidate the progress we have achieved in the previous epidemic campaign. And we hope that through the help of the media, the whole society can be mobilized to cultivate a healthy lifestyle and a health promotion environment. Thank you. Let's continue. On the right, on the fifth row, the gentleman close to the aisle, please. Thank you. With Guangming Daily. Recently, in Guangdong, Wuhan, and Sichuan, there have been the reinfection cases, and in Wuhan, there's a fatal case, which was actually the reinfection case. So for such reinfection cases, are the symptoms getting serious? And there could be, what are the measures adopted to prevent such a situation? We will have Dr. Wang to answer the question. Thank you. Indeed, we do notice such a relapsed case. The positive conversion study is going on, and we need to wait for the findings. Also, actually, on March the 3rd, in the 7th treatment protocol, we had updated the protocol by mentioning the reinfection, and we suggest to amend the hospital discharge criteria by including other testing indicators or repeated results. So for such a hospital discharge, it is now requested to have 2 negative results before the patients are discharged. And also, even after they are discharged from hospitals, the people are requested to stay at home for 14 days further quarantine. This is like a self-quarantine. They should stay in an individual or a separate room and live in the separate room with good ventilation. And also they should pay attention to the good hand hygiene or sanitation. This is requested to prevent the potential spread of the epidemic. for the reinfection, the overall proportion is not high, even though there's a couple of such cases. But for the specific proportion of reinfection, we have to wait until the pandemic is over. The current percentage is just a data based on the available information, but overall, such reinfection is quite rare, and we didn't find the reinfection will cause a major risk for further spread of the epidemic. As for the reinfection or the conversion of the result, there are several teams who are working on the study. Some data show that among the reinfected cases, there is a couple of cases who received the gene sequencing and found the positive result, but the proportion of such population is very limited. And also in terms of the virus isolation, there are several teams working on it, but at the moment they haven't isolated the virus from the reinfected cases. So we are working on these reinfected cases, and for these population group, we emphasize that quarantine and follow-up monitoring is extremely important, and they should receive a timely treatment once reinfection do occurs. Let's continue. On the left, on the third row, the lady reporter, please. Thank you. With Hong Kong Economic Herald, up to now, most of the localities in China's mainland are low-risk areas. So my question is, in recovering the business, what are the prevention and control measures? Compared with the previous high-risk status, what are the differences? We will have Madam Wang to answer the question. Thank you. Indeed, at the moment, most of the localities in China's mainland are low-risk areas. To facilitate the recovery of the operation and business, the State Council's joint control mechanism have worked out several measures to facilitate to improve the overall environment from various aspects, such as ventilation, the personal protection, and etc. Overall, you can see that for high-risk areas and inbound travelers, they should be well monitored and managed based on the local conditions. Second, for people from the low-risk areas, there's no quarantine requirements for them. And the second, for employees in the high-risk sectors, they should wear masks according to the professional requirements, while employees of other common sectors, they don't need to wear masks. And in the specific localities, they should follow the local requirements. Furthermore, for people who are exposed to the potential risk of the epidemic, they should follow the public guidance to decide whether they should wear masks or not. And we will continue our Q&A on the left, on the second row. The gentleman, please. With People's Daily, we know that at the moment there are high-risk, medium-risk, and low-risk areas in China's mainland. Then what about the different measures or approaches to recover the medical service order? And it is also said that such recovery might actually lead to the jump of medical services requirements. So how are you going to deal with it? We will have Madam Guo to answer the question. Thank you for your question.
Yes, indeed, after the outbreak of the epidemic, there has been some impacts on the normal hospital orders. The National Health Commission pays great attention to the restoration of normal hospital orders. Since the middle of February, we've issued several documents requiring localities to implement the risk-zoned approach and have precise methods, and differentiated the restoration of normal hospital orders in low-risk regions. The normal hospital orders should be restored fully, providing daily services, make a reasonable allocation of resources. Outpatients, emergency departments, and surgeries must be ensured in the moderate risk zones. On top of prevention and control of the epidemic, the work focus should be shifted to the gradual restoration of normal hospital orders, and in the high-risk regions, apart from good prevention and control of the COVID-19, there should be more resources channeled to the restoration of orders to ensure the key needs are met. We've made a survey across the nation. We found that across the country, compared with the same period of last year, the medical treatment provided hospitals are around 60% of that of previous year. There has been only slow recovery in the hard-hit regions. So we need to refresh our orders. On one hand, we need to enhance external support, including optimization of policies, improve incentives, ensure medical supplies. On the other hand, we should guide health institutions to refine their management. One hospital should have a tailor-made approach. One department should have a contextualized approach. Meanwhile, we should leverage Internet plus medicine and promote the appointmented services and stagger the services, enhance remote or telemedicine, prioritize the needs of emergency needs met. Emergency services should be around the clock. Thank you. Next question, please. Thank you. With Shenzhen Satellite TV, it was reported in early stage of the epidemic response, there were dents on the normal hospital orders in Wuhan. 40+ hospitals have resumed their normal operation. What are the services provided by these comprehensive major hospitals apart from these 40 hospitals? What about the situation in other hospitals? There were also hospitals requisitioned to be designated hospitals. What is the situation now? And the services provided to children, the elder citizens, their needs met? When can we expect the full restoration of normal hospital orders in Wuhan? Well, that is a long question. I'd like to ask Madam Guo to take the question. Yes, indeed, that is a very long question. You may have already noticed the patient's treatment, the COVID-19 patient's treatment in Wuhan has been the shared concern of all Chinese doctors and all of us. We are gratifying to see that with the joint efforts, there has been very positive outcome. The discharged patients are on an ever-increasing trend. Meanwhile, Wuhan is also accelerating the recovery and restoration of normal hospital orders. The restoration of the normal healthcare system to ensure the needs of non-COVID-19 patients. Wuhan City has made coordinated efforts to prioritize the needs of acute diseases, critical diseases, and emergency situations. In the overall planning, full attention was given to the convenience of the general public. Efforts were made to coordinate health resources and doctors and nurses. On the official website of Health Commission of Wuhan City, on a daily basis, there is the publishing of information on the hospitals that can take patients, non-COVID-19 patients, the departments and of outpatients and hospitalized patients. Yesterday, I've noticed that 43 hospitals in Wuhan have resumed their normal hospital orders and functions in taking in non-COVID-19 patients. Yesterday, the outpatients number reached 20,000 plus. The beds opened were 18,000 plus, and they took more than 10,000 inpatients. As we poured COVID-19 in designated hospitals, there will be some original designated COVID-19 patients, hospitals, which will go through disinfection, sanitation, and restore their normal functions to take non-COVID-19 patients. I believe all these efforts are ongoing at full speed with full pursuit. Thank you. Next question, please. Thank you. With the China Population newspaper, we've said that there is increasing number of discharged patients. What is the consideration of NHC on the rehabilitation of discharged patients? I'd like to ask Madam Guo to take the question. Thank you for your question. Yes, indeed. 70,000 plus COVID-19 patients have been cured and discharged from hospitals. With the ever-increasing number of the discharged patients, we are considering a better job in rehabilitation management and the services of the patients. This has already become one of the priorities. Previously, we've issued rehabilitation protocols, health management plans, making it clear that discharged patients' respiratory, physical, psychological functions need to be taken care of, and their rehabilitation need to be assessed. The assessment results, for example, in the mild patients group, after they are discharged from hospitals, we focus on guiding their home-based rehabilitation, restore their physique. For the severe patients who were cured and discharged from hospitals, respiratory functions, physical and psychological functions need to be assessed. Specialized rehabilitation institutions and the rehabilitation staff need to be engaged to help them for full rehabilitation. Thank you. Next question, please. Journalist on the left. Thank you. With the China Health magazine, Beijing Ditan Hospital has researched and found that the novel coronavirus may attack neural system of the patient. What should be alerts for the hospitals and the patients? Will there be sequelae effects for the cured patients? I'd like to ask Director Wang Guiqiang to take the question. Yes, indeed, Ditan Hospital of Beijing has reported one case of patient. He was a severe patient, and during the treatment, seizure illusion was found, which was the impact on the CNS system. So there was a further check in the cerebral liquid, and the NAT test results have shown virus in the cerebral liquid, which alerts that virus might be the reason for the CNS damage. Many viruses may be coming into the circulation. It breaks the brain plasma barrier and lead to further cerebral diseases. Foot-mouth disease and other flus may break the barrier of the brain plasma. So this is commonly seen by viruses. The likelihood of coronavirus breaking the brain plasma barrier is not highly likely. There, among the 150 plus patients taken by Ditan Hospital, there was only one such case found, but it gives us important alert that the novel coronavirus may damage the CNS system if there is a seizure illusion occurred by patients. Then we should have a certain alert and make interventions, because once the CNS is damaged,
there might be edema in the brain and other symptoms, so we need to keep alert against such potential CNS affection. And also for COVID-19, the major symptoms are the symptoms in the pulmonary system, but there can also be other organs affected. We are the clinicians and the scientists are working on the harm done by COVID-19 to the human system, and we are looking forward to such research findings. I can see that today's topic is of great interest to our journalists, but due to the time constraint, we can only allow 2 more questions. On the right, on the second row, the lady reporter, please. Thank you. With health news, we found that in the data released by NHC, there have already been 70,000 cases cured and discharged from hospitals. So what are the post-hospital management and what are the health management to ensure their full recovery? And we will have Madam Guo to answer the question. Thank you for your question. Yes, indeed. For patients who are cured and discharged from hospitals, there should continue health management. This involves follow-ups and also other health management measures. Before they are discharged, the health evaluation is conducted, and then based on the evaluation results, a 2-week or 4-week follow-up plan is expected to be developed. When the patients are discharged from hospitals, the handover should be managed in a sound way. The patient's information should be sent to the community clinics or the designated quarantine venues. So the neighborhood committee or the community healthcare clinics are expected to receive such information, as they will take over the health management and monitoring of the particular individuals. Also, once the patient is discharged from hospitals, the 14 days of quarantine will be initiated, and also in 2 weeks or in 4 weeks' time, there should be follow-up check with in the hospital. So the follow-up monitoring, the health management, and the hospital revisits are all components of such health management. Last question on the left, on the 4th row, the lady reporter, please. Thank you. With Chinese families news, according to media reports, starting from March the 14th, vaccination in Wuhan has been initiated again. Vaccination is quite important for health of the kids. However, during the epidemic, parents were concerned about bringing their kids to take the vaccination. So may I know more about the vaccination services in Wuhan and Hubei province, and what are the measures to facilitate such vaccination? We will have Madam Wang to answer the question. Okay. Just as the reporter has described, vaccination is very important for the health of the young people. In order to prevent the potential negative impact of the epidemic, we have made the following efforts. First, we had a systemic review on the potential impact caused by the epidemic, and then based on the review, we come up with solutions. We found indeed that in some localities, with proper protection installed, the vaccination was conducted as normal. And secondly, as the epidemic containment situation is improving, we request the localities to restart the vaccination program and provide the timely vaccination as scheduled. Now, except the Hubei province, the epicenter of the epidemic, all the other localities have already resumed the vaccination program. We also request the localities to adopt various approaches to make appointment for the vaccination, and also such appointment is made based on the sound and justified approach to avoid potential crowding or busy visits in the vaccination clinics. And also, we are following the EPI program to supplement the previous scheduled vaccination. And therefore, for kids, they don't need to start from the very beginning. They just need to supplement what have been missed. That's all for today's Q&A. And now we will have our expert to share with us some legal knowledge. We will have Professor Wang from the Tsinghua University. Thank you. It's my pleasure to answer questions related with the prevention treatment of the law on the infectious disease prevention and treatment law. Recently, there have been some cases involved with the endangering of infectious disease prevention and treatment. So, under what context will such cases be filed? As you know, the communicable disease prevention and treatment is about people's health, and it needs the involvement or engagement of all the citizens. The most effective way for epidemic prevention and control is to cut or curb the spread of the virus. So we need to identify, trace back, and analyze the potential spreading channel or transmission routes of the virus. Only by doing so can we curb the spread of the virus. Every citizen has the legal obligation to be active in this prevention and control. According to the law on the communicable disease prevention and treatment, Article 12 stipulates that all the entities and individuals in the People's Republic of China should take the investigation and testing, sample collection, quarantine treatment, and other prevention and control measures conducted by the disease prevention and control agencies and the medical agencies, and they are expected to provide information faithfully. If there's any violation against this stipulation, then according to the policy guidance issued by the Supreme People's Court, the Supreme Prosecutorate, the Ministry of Public Affairs, and the Ministry of Justice, this will be considered as if the behaviors constitute one of the following two scenarios and endanger public security, then following Article 114 and Article 115 of the Criminal Code, such cases will be filed as endangering public security.
So the first that can be convicted are confirmed COVID-19 patients or the pathogen carrier refuse to be quarantined and treated or leave the quarantine venue before the end of the quarantine period and access the public places or public transportation vehicles. Second, suspected COVID-19 patient refuse to be quarantined or treated or leave the quarantine venue before the end of the quarantine period, access the public places or public transportation vehicles, and led to the transmission of COVID-19. Other violations include those refusing to follow the prevention and control measures that may lead to the transmission of the novel coronavirus or lead to transmission hazards and risks. And they will be convicted and fined and punished according to number 330 clause of the criminal law. Since the outbreak of the epidemic, prevention control measures have won the wide support from the general public and have been effectively implemented. However, recently we have seen practices by confirmed patients in hiding their whereabouts, covering up their tracks, and hiding their symptoms. Ministry of Public Security and the judiciaries have timely dealt with such behaviors. Personal tracks and whereabouts and health conditions do belong to privacy. However, the hiding and covering up of the information may impact our understanding of the transmission pathways, and this may cause threats to individual health and public security. Therefore, each individual, each citizen should follow the requirements of prevention and control and report their travel history, residence history, temperatures, symptoms according to law and truthfully, and honor their legal obligations of staying home quarantine and be put under medical observation, conscientiously participate in prevention and control. Thank you. I'd like to thank Professor Wang. I have been counting, and on today's press conference, we've taken altogether 18 questions from our journalists. I'd like to thank you for your attention, and I'd like to thank the guest speakers for providing answers. Tomorrow we'll focus on the resumption of key projects. We will have officials from NDRC, Ministry of Finance, and Ministry of Natural Resources to take questions. We look forward to your continuous attention. With that, we conclude today's press conference. Thank you.